Okay, so here's our model. Our model helps to visualize the ankle joint. As you can see, there's two rubber bands respectively on the anterior and the posterior side. The rubber band on the anterior side represents the tibialis anterior and is responsible for dorsiflexion of the foot, which basically means that when it contracts, the ankle joint will move the foot up towards the shin. This muscle, the tibialis anterior, originates from the lateral condyle of the tibia, as you can see here, and then inserts itself into the first metatarsal of the foot, so the big toe metatarsal, which is on our model. The rubber band on the back, the posterior side, represents the gastrocnemius. It helps do plantar flexion of the foot, which means that when this one contracts, we'll bring the foot back or even farther. So, like, as you can see here, this muscle originates from the medial and lateral condyles of the femur, and then inserts itself into calcaneus down here via the Achilles tendons. That's what it connects to. Overall, our model does a good job showing the different bones in the foot. It has obvious metatarsals and the femur, but it also kind of shows like the patella and other things that just kind of make the model more interesting and detailed to look at. Our model does a good job representing the muscle location. Everything looks well. You can obviously see the rubber bands work fine to show how the muscles work, and the muscle rubber bands work well in our model. However, our model does have some limitations. First, like, the joint itself needs some improvements. It's kind of flimsy at times. It's also kind of stiff at times, so it just doesn't work well. If we could have redone it and made it work better, we should, to make the model better. And then also just taking time to add more detail. Obviously, everything's very vague. We could have added more projections to the bones, made it look more real life, just to have a better model in general. But overall, our model of the ankle joint worked well to demonstrate how the joint works and give an accurate depiction of, like, the tibialis anterior and the gastrocnemius.